Hi there my highly esteemed colleagues. My name is Dr. Nath Arua, a member of the Pharmacy Department Quality Team. I would like to welcome you all to this video entitled, Elements of a Complete Medication Order. I would like to begin by emphasizing the fact that a failure to adhere to the policy for elements of a complete order can result in prescribing, dispensing, and even administration errors or near misses, with far-reaching consequences. It is with that background in mind that the departmental quality team compiled this video. Welcome and please view and listen to it keenly. In this second slide, we address the question, what is the purpose of this policy? This policy ensures that all orders are written in a consistent manner in order to ensure patient safety. Remember, medication errors can occur at the prescribing or transcribing stage. Implementing and enforcing this policy will help reduce the occurrence of these errors. We seek to sensitize you to always remember that patient safety begins with you. In this slide, we address the question, what are we supposed to do as pharmacy staff? On receiving a prescription order or treatment chart, staff should do the following. 1. Confirm it has an addressograph identifying the patient. 2. Ensure the prescriber's name, signature and department are indicated on the treatment sheet in appropriate section. 3. Check if drugs on admission form has been filled fully, capturing details such as name of medication, its dose, route, frequency of administration and time the last dose was administered. Medication reconciliation is done and it entails comparing the initial medication orders to the list of medications taken prior to admission. 4. Once medication reconciliation has been performed, stick that medication review sticker on the appropriate section of the treatment sheet. Also remember to insert a pharmacy comment indicating whether or not the patient was taking any drugs upon admission, by accurately ticking the checkboxes on the sticker. We should also ensure all the elements of a complete order are met. These elements include 1. The name of the drug, that is brand or generic, the dose, the frequency and the route of administration, as per accepted abbreviations. 2. Patient names and AK number on the addressograph. 3. Date of birth or age of patient. 4. Height and weight of patient, especially for pediatric and chemotherapy orders. 5. Drug or food allergies. 6. Date of prescribing. 7. Signature and name of prescriber. If this is filled fully on first page of treatment sheet, then subsequent pages need only the prescriber's signature. 8. Duration of treatment. Remember, for outpatient and discharge prescriptions, it is compulsory, while for inpatient prescriptions orders have a 7-day duration and then must be rewritten and reviewed where applicable. 9. Directions for use for external preparations or rate of administration when intravenous infusions are ordered. In case none of these situations apply, indicate not applicable. Ensure all medication orders are written in the appropriate section of the treatment sheet. 1. Our treatment sheets are distinguished by age classification. That is, A, for pediatric, less than 14 years, the treatment sheet has a pink first page. B, for adults, that is, 14 years and above, treatment sheets have yellow first pages. 2. Surgical prophylaxis orders should be written on the front page. 3. Stat or one-time doses should be written in the designated place. 4. PRN are as needed prescriptions with indication and maximum frequency. 5. Antimicrobial section, the yellow part of treatment sheet. 6. Regular prescription. 7. Discharge or take-home medications section. Next, I would like to briefly address the issue of endorsement of orders. Pharmacy staff, when filling the order, will endorse the brand name when the prescription has generic or chemical name. This is applicable especially where multiple brands of the same drug exist and are stocked by the pharmacy department. In principle, for generic name prescribing, the cheaper brand generic will be chosen and endorsed on the treatment sheet or prescription, unless otherwise specified by the prescriber. For combination drugs, the pharmacy shall assign a brand product from the drug formulary without further reference to the prescriber and endorse on the prescription. And now, let's briefly discuss the issue of cancellation of orders. All medication orders, when discontinued, must be done in a uniform way, to avoid medication errors. Prescribers should cancel as shown in the illustration on the medication order, that is to say, 2 horizontal lines and a joining vertical line in the center. The discontinued medication order must also be signed and dated adjacent to the cancellation by the authorized healthcare provider discontinuing the medication order. In this slide, we illustrate an appropriately cancelled medication order. Kindly pause the video and scrutinize it closely to familiarize yourself with the correct cancellation style. Let's now shift our attention to the hospital antimicrobial stewardship policy. Remember to confirm if there are restricted antibiotic orders. These shall be dispensed as per antimicrobial stewardship policy as below. According to this policy, Category 1 restricted antimicrobials are those that must be approved by the infectious diseases physician before dispensing. Remember to confirm with the clinical pharmacist in your unit or on call. Category 1 restricted antimicrobials include Teicoplanin, tigecycline, echinocandins such as caspofungin, micafungin, polymyxins such as colistin which is polymyxin E and polymyxin B, linezolid oral tablets and injection, remdesivir and tocilizumab or COVID-19 patients, and ceftazidime avibactam. Category 2 restricted antimicrobials include antimicrobial agents which can be dispensed for empiric therapy for 3 days before review for infectious diseases team approval. They may be dispensed beyond 3rd day upon establishing from the clinical pharmacist on call. Whether approved or not, they include all carbapenems like meropenem, ertapenem, imipenem, celastatine and doripenem. Apart from that, the following also fall in this category: vancomycin, piperacillin, tazobactam, ceftazidime and cefepime. In all cases, the decision of the infectious diseases physician and communication from the clinical pharmacist must be endorsed on the prescription, e.g., approved by Dr. X, informed by clinical pharmacist Y on date Z. And now, let's briefly discuss about medication appropriateness review. Good medication management includes 2 reviews of each prescription or order. Firstly, the appropriateness of the medication for the patient and his or her clinical needs performed at the time the medication is prescribed or ordered. The verification at the time of administration that the medication is exactly as ordered. A new appropriateness review is done when dosage or other appropriateness factors change. A full appropriateness review is done at the time the medication is first prescribed. It is done by pharmacy staff or any other trained and competent healthcare provider. Staff review the order for compliance with elements of complete order policy as described above. The process to conduct the first appropriateness review for an order or prescription prior to dispensing includes evaluation of the following. A. The appropriateness of the drug, its dose, frequency of administration, and route of administration. B. Any therapeutic duplication. C. Real or potential allergies or sensitivities. D. Real or potential interactions between the medication and other medications or food. E. Variation from hospital criteria for use. F. Patient's weight and other physiological information. And G. Other contraindications. Appropriateness reviews must be conducted even when circumstances are not ideal. For example, if the central pharmacy or a unit pharmacy is not open, or the drug will be dispensed from stock on the ward or clinic. The appropriateness review may be conducted in conjunction with the verification review when the ordering individual will administer the medication and monitor the patient. Critical elements of an appropriateness review include at least the following: I. Drug or food allergies. J. Lethal drug-drug interactions. K. Weight-based dosing. L. Potential organ toxicity, for example, administration of potassium-sparing diuretics in patients with renal failure. The review also entails verification of prescriptions for therapeutic duplication, a scenario where 2 or more medicines with same mode of pharmacological action are co-prescribed and administered. Checking for contraindications due to a pre-existing disease condition or medication. Appropriateness review of the order or prescription if a newly prescribed medication can affect the kidneys or liver. The appropriateness review includes specific clinical information about the patient's renal and liver function, as well as when these organ functions change. Once the appropriateness review is done, pharmacy staff should sign and date on the treatment sheet on the designated section. Let's shift gears a little bit and talk about the verbal order policy. In case clarification of an order requires that a verbal order be taken. In case an initial order was written on the treatment sheet, cancel out that order as per policy and write a new order on the treatment sheet. Do not overwrite on the initial prescription. Place a verbal order sticker on the treatment sheet and fill it out as indicated. Supply medications for 24 hours. And ensure that the verbal order sticker is signed within 24 hours. If there is a ward doctor on the floor, do not take a verbal order. Instead, have the ward doctor rewrite the order. This slide briefly discusses the illegal abbreviations, their intended meanings, the potential problems that could arise if they are misinterpreted, and the preferred terms prescribers should use in Aga Khan University Hospital. I recommend you pause the video at this stage and closely scrutinize it for better understanding of the issues discussed therein. Ladies and gentlemen, that brings us to the end of this video. I hope you gleaned useful knowledge from it. Apply it, and ensure prior to dispensing any medication or filling any prescriptions, there is full compliance with the policy. This will go a long way to ensure safe medication use and management. It's now my pleasure to request you to kindly access the quiz on the link provided below. You can easily do so by copying and pasting the link onto your web browser. https://forms.play/6remagtvp2nhcox9. Good luck.